What about the medication?
Yeah. See, majority of the time, if they take the treatment, the improvement is guaranteed. Majority of the patients are able to overcome this phobia, or they get relief from this panic attack. So we have certain medicines which we start. One of the most widely used medicine is called paroxetine. It's a very good medicine. We start with small dose of say 25 milligram, and we can increase the dose up to 75 milligram if necessary. And these, once they start taking this medicine, the frequency of panic attacks gradually decreases, and sometimes they stop getting panic attacks altogether
Oh, nice.
over a period of 8 to 12 weeks.
Okay.
We also give them rescue medicine. So there is one medicine called clonazepam or alprazolam, which we give them, and we say, okay, this is a medicine, this is your doctor. You keep this medicine 24/7 in your pocket or in your purse, and think that I am carrying my doctor in my pocket or in my purse everywhere. So I have a doctor in my pocket, I have a doctor in my purse who is going to travel with me, and he is going to be there all the time with me. Now, suppose you get a panic attack when you are traveling in train or on the road or in the crowded places or while you are watching a movie. You don't have to actually panic. It's a panic attack. But then when you get a panic attack, everybody panics. The relatives also might panic and they want to come out, etc. So when you get a panic attack, you don't have to panic. Or even you don't have to anticipate panic attack, because then there is anticipatory anxiety if you don't have the medicine. Okay, if I go out and I get a panic attack, what will happen? So I avoid going to the party, I avoid going to the some program. So now you don't have to worry about anything. There is no anticipatory anxiety. You are well prepared to take care of the panic attack. So you have these medicines with you. Suppose you get a panic attack, you start feeling anxiety, you start getting palpitation. What you have to do, you have to tell yourself, I don't have to worry. Nobody in the world has died because of panic attack, so I'm not going to die. I don't have to worry about that, though it feels like impending doom, but nobody dies. So number two, I'm not going to die. What I need to do is relax, and if necessary, take this medicine. So just sit down, take a long and deep breath. If you have access to water, drink a glass of water slowly, gradually over a period of time, say 1 minute. And when you are able to relax, the panic attack may immediately go away. Suppose you are still little worried and panic attack continues, you have a medicine with you. You just take one medicine, put it under your tongue. It will melt immediately, and within 5 minutes, you will have a relief from your panic attack. You don't have to rush to the hospital. You don't have to get admitted in intensive care cardiac unit. You don't have to get your ECG or 2D echo done. You don't have to get your enzymes done. And as you develop once, twice, and you get confidence, then you are able to travel all over the world. You don't remain housebound. Plus, if you need to stay alone at home, you are able to stay at home alone. So we continue these medicines, and within 8 to 12 weeks, they develop the confidence. We may have to continue for another 8 to 12 weeks as a maintenance dose, or sometimes even longer as a maintenance dose. And once they get confidence, once they start traveling all over the world, and once they have learned the behavioral techniques like relaxation, yoga, meditation, savasana, pranayam, which we encourage them to learn over a period of next 2 to 3 months. And once they have learned, they don't have to worry at all. Just by behavioral techniques, by doing savasana or pranayam, they can take care of their panic attack.
Okay. So, doctor, thank you so much. That was so much details that you gave about the panic attack. I also have some people telling me that some seniors telling me, especially that they get up in the night, like perspiring, and they've had some dream which was like very disturbing and all. Is that also part of panic attack?
Yeah. So see, some people get panic attacks during night, during sleep, and suddenly they wake up with panic.
Hmm.
So if it's a only panic attack
Hmm.
which they are getting at night, you take this medicine at night. Usually paroxetine is given at night.
Hmm.
And at that time also they can take this tablet clonazepam, which we give them for panic attack, or alprazolam, which we give for panic attack.
Hmm.
Now there are some people who get either nightmare or night terror.
Okay.
Nightmare is a frightening dream.
Hmm.
And
Hmm.
you get up and you remember that dream. Oh, I had a frightening dream, and thank God it was a dream and it's not a reality.
Hmm.
But you clearly remember.
Hmm.
There is another condition which is again a sleep disorder. Nightmare is a sleep disorder. Night terror is a sleep disorder where the person is unaware. Suddenly he gets up and starts shouting.
Hmm.
Say, for example, one of our patients suddenly felt that there is a house on fire.
Hmm.
So once in 3, 4 days or once in a week, he suddenly wakes up and starts shouting, "Fire, fire, fire, house on fire, house on fire."
Hmm.
And he actually feels that there is a house on fire. And
Hmm.
then everybody wakes up and somebody brings the water and somebody brings a bucket of water, and then they see that there is no fire.
Hmm. Oh.
And then they wake him up and say, "Arey, arey, what happened? What happened?" And he wakes up. He comes out of that night terror episode and he says, "What happens? I didn't do anything. Why are you all over here? Why are
Hmm.
you bringing waters and what are you doing over here in my bedroom?"
Hmm.
And he doesn't have any memory of that kind of phenomena which has occurred at night.
Hmm.
That is called night terror. And those episodes can occur once in a week, once in 2, 3 weeks, once in 2 to 3 months. If they
Oh.
are occurring once in 2 to 3 months, we just kind of do the counseling with the relatives. It's a once in 3 months, it might happen.
Hmm.
You just have to wake him up just by petting him and just shaking him, waking up and say, "Don't worry, there is house is not on fire," or
Okay.
whatever symptoms are. And he wakes up and he says, "Okay, okay, probably I had something. I
Hmm.
can go to sleep." And he goes to sleep again.
Hmm. Hmm.
Suppose these attacks are very frequent, 2 to 3 times in a week, then
Hmm.
again you can give certain medicines
Hmm.
and he will stop getting these nightmares and he will stop getting these episodes of night terror.
Hmm. 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 Oh.
So
Okay.
if they have these attacks during night, we have to see whether it's a nightmare, whether it is night terror, or whether it is a panic attack occurring at night. And he wakes up from panic attack.
Hmm. 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 Okay. Right. Interesting. And now that this war thing is going on in India, and would you suggest that looking at the news could also give them anxiety and
Yes,
so
what we call normal anxiety or physiological anxiety.
hmm,
It's a healthy anxiety.
okay.
I am prepared, I am ready. It's a readiness. So that is a good anxiety, healthy anxiety. If I have an exam after 2 days, I am little well prepared. Healthy anxiety. कि, हाँ, my exam is there. I am serious and I have to study well, prepare well for the exam.
Hmm,
That anxiety motivates me to prepare well for the exam and do well in the exam, which is called healthy anxiety.
okay.
But sometimes the anxiety is so much that it overwhelms me. It's an overwhelming anxiety which will deteriorate my performance in the exam.
Right, right.
That is unhealthy anxiety.
Thank you so much, Doctor. Thank you so much for giving us such valuable information. I'm sure it's going to help a lot of us.
Yeah.
Thank
Thank
you.
you for inviting me and giving me this opportunity to speak on panic disorders and how to handle anxiety.
Thank you. Thank you.